Ya Ali Madad. Women's Activity Portfolio Tanzania is proud to welcome you on board on our program Chat Over Chai. Today, we are going to talk about female body and different stages and cycle all women go through, starting from menstruation, perimenopause to menopause. As we all know, women are the work of art on the outside as on the inside. So without taking much of your time, I'm very proud to introduce our expert today, Dr. Jane K. Muzo, who is a consultant gynecologist and obstetrician at the Aga Khan Hospital, Dar es Salaam. Welcome, Dr. Jane. The platform is yours.
Thank you, Frazana. Welcome once again, and I'm going to talk about menstruation, that is the menstrual cycle. Now, the menstrual cycle, it's a normal physiological process that occurs in girls from the age of 9 to 11 years, but there are some girls who experience it earlier, before the 9 years of age. And this is very normal in our society and community. So menstruation, it's a cycle that only occurs in girls, as I said earlier, and it involves two phases, the follicular phase and the luteal phase. The follicular phase begins from the day the girls start experiencing menstruation, and menstruation can go up to 7 days and or less, depending on the hormonal response, and up to the time the egg is released from the ovary. And that, in other words, is called the mid-follicular phase. After the egg has been released, then we come to the luteal phase. The luteal phase consists of 14 days, and these 14 days are fixed. The follicular phase varies from 14 days to 21 days. And every girl or woman has a different cycle depending on hormone response, and it tends to vary between 26 days and 32 days. This is normal to any girl or woman. But if the woman has a cycle that is 32 days or longer, then it's determined the longer cycle. If it is less than 26 days, this is termed as a short cycle. The cycle has a very important meaning to our body. In a sense, it helps us to understand the danger days, as I said earlier, when the ovum is released or the egg. This is the point whereby if someone has unprotected sex, can get pregnant. And the other days also tends to warn us and prepare ourselves in terms of other menstrual symptoms and signs that might need or warrant a woman or a girl to take pills depending if they have pain or no pain during the particular cycle. It also guides us when it comes to family planning in terms of the natural ways of monitoring ourselves and protecting from having unintended pregnancy. Because right now globally, we have so many unintended pregnancies, and the only way to understand the cycle and also use the contraceptive I'm going to talk next. The family planning now. Family planning methods that have been established in order to ensure that every girl or woman has an access to protect themselves from having unintended pregnancy. But also when it comes to the family, it plays a role in making sure we keep to take care of our children for as long as recommended, 2 years and above, to ensure that they're healthy, we have a healthy family, good support, socio-economical, fit, and also mentally and psychological wise. So the family planning methods, they are divided depending on the method of choice the woman will decide based on the length of the size of the family or the children in the family. When I say this, I mean whenever we have or we intend to have a family, we have a plan as a couple, or as a girl or as a woman. When you're in your career, you determine when you want to have a children. So it helps in that sense. So the short family planning method, there's the natural methods, and then we have the modern contraceptives where we have the barrier methods and the hormonal type of contraceptives. Now, when you come to talk about the natural methods, we have 3 components that are regarded. We're looking at the cervical mucus. It helps a lot in terms if it is very thin, slippery, like the mucus discharge that a woman sees. If it's very transparent, this gives us a sign that probably the egg is being released. But also the basal body temperature that we tend to monitor with the thermometer regularly every morning. If there's an increase by 0.5 degrees centigrade, this alerts a woman that the high chance that she's going to ovulate, thus having unprotected sex will not be safe, will get pregnant. But the other method that we look at is the calendar-based method. The calendar-based method, this works very well for the women who understands a cycle. As I said earlier, we have women with a longer cycle, normal cycle, and shorter cycle. So for a woman who has an irregular cycle, or the cycle is not clear, it's not easy to use the calendar-based method. So it's only recommended for those that have a regular cycle to use this method. As I said earlier, it's look at you calculate by deducting the luteal days, and these luteal days are fixed. So if the woman knows when the ovulation takes place, it can become safe. Usually for the normal regular cycle, the safe days are there from 8 to 19 days are not safe days. And this is clearly illustrated by using the cycle beads, which you see on the screen. These cycle beads follows the length of the cycle. So the first 7 days, these are safe days. From 8 to 19 days, these are not safe days. And from 18 days up to the time the woman menstruates, these are safe days. So the cycle beads helps the woman whenever the day moves on, she moves on those cycles and helps her to be safe. Now the burial methods, these modern burial methods, we have three types. We have the condoms, the female male condom, we have the diaphragm, we have the cervical cap, but also spermicides, they're also part of the modern contraceptives. Now the burial methods, the good thing about them, they tend to protect a woman from getting sexually transmitted infection, as well protect from getting pregnant. And they don't have any side effects at all, unless if someone is allergic to the particular type of the material that is being used to make the condoms in the industry. But regularly they are safe if the instructions are followed. Now for the condoms, female and male condoms, they don't need to put anything. You just follow the instruction, well inserted, and the woman is safe. For the diaphragm, there's an importance of putting spermicides, so that by the time the man comes to have sexual intercourse with the woman, it works very well in terms of making sure the sperms are killed, because it kills the membrane of this particular sperms. But also for the spermicide, there's the timing. For the diaphragm, needs to be inserted at least 6 hours before having sexual intercourse, and should stay for 6 hours longer to be effective. For the spermicides also, 10 minutes before the act, and should be put with every act. So if a woman uses only once and does not apply the spermicide again, high chances are there of getting pregnant. Having said all this in the short-term contraceptive burial methods, spermicides and the other one called withdrawal methods, all these tend to be less effective compared to others. And having said that, we don't encourage people to use these spermicides and withdrawal methods because there are chances of a woman getting pregnant. The other type of contraceptives, these are the hormonal, the pills. They're known as combined oral contraceptive pills. We also have emergency contraceptive pills, and we also have the progestin-only pills. All these pills are essential for a woman to protect from getting pregnant, and it's important to follow the particular guidelines on how to take the pill, because once you miss the pills for 2 days or 3 days, you need to follow up with the health provider and focus on how to protect yourself from getting the terminal pregnancy. But also these pills are provided in terms of knowing the medical condition of the individual. So before we do provide these hormonal pills, we consider what we call MEC, medical eligibility criteria, whereby we assess the woman if she's eligible for the informed choice of family planning before we provide the family planning. So coming to the long-term contraceptives, we have the modern contraceptives, the traditional devices, but also we have the surgical methods. And also we have the implant, or they call it implant, some of the people. So to start with the IUCD, that intrauterine devices, there are two types. We have the hormonal type and the copper T 380A. Now the levogestrel, this is the hormone that works very well, but only lasts for 5 years. After 5 years, should be removed. For the copper T380A, this one can stay for 10 years, but studies have shown that it can stay up to 12 years. Now, all these are informed choices based on the individual choice will be provided. They don't have any side effects apart from for levogestor, just have the normal side effects as the other hormones, such as headache, nausea. Can also have, some can tend to have vomit or irregular cycles, but very rare women will experience these symptoms. And when it comes to the implanon, it's a levogestor and progestin-like hormone. And these hormones, they vary. There's a 3 years and 5 years. For the surgical, we have for women who have tubal ligation, bilateral tubal ligation. For men who have vasectomy. The tubal ligation process is done in theater and under anesthesia for comfortability, and it's usually not reversible. It is recommended for women at the age of 35 and above, because usually studies have shown that there's a chance of negligence why someone has done it earlier while they're still fertile. So we usually take precaution and can do thorough counseling before a woman is involved in the surgical procedure of closing the tubes. Vasectomy is for the guys, and this we advocate as much as possible. Still, our community is not well aware of, and not many of them that are coming up, but could even be easier because the men are the ones that when they come in contact with a female partner, they get pregnancy. And with all this said, family planning choices are different, and we have the short term and long term, and they really tend to work out depending on the woman, the female body, how it responds, and every choice is provided depending on the condition of the woman. And this is very important. Please do not go outside and get it yourself over the counter, because you might be a risk factor for using one of those particular contraceptives. And once again, it builds our family, builds our community, unites us in terms of being socioeconomically fit, psychological, as well as have a stable family and grow and development in our nation. With all this said, thank you.
Now I'm going to introduce our next guest, who is a beauty with brains, Mrs. Femina Jamal. She is going to represent all the women out there, sharing her journey in menopause. Welcome, Mrs. Jamal.
Thank you, Farzana. What a lovely compliment.
Thank you.
I have a confession for all the women out there. You are not alone. Menopause is very natural for women to go through. And yes, it has its side effects, and it has its highs and lows, ups and downs. Eventually, we all go through it. It's very natural for women to talk about it and to discuss it with your family members, especially with your spouses, be it with your other family members like your kids, your in-laws, your siblings, or your best friend, who are the best people who can understand you and support you. Yes, so as Farzana said, that I'm going to share what I have been going through. Lately, I have been feeling the symptoms, and yes, they are good, they are not good, but they are controllable. With the hard work support of my family and the help of the doctors, it has made my journey not so hard and not so complicated. I have had 2 natural births without any complications, and I have now come to a phase in my life where menopause is playing a role in my life. The unbearable hot flushes, the horrible mood swings, the feeling of fatigue, the uncomfortable bloating of the body, the feeling of irritation in itself and the anxiety attacks, the feeling of not being yourself and the low esteem, the forgetfulness, the changes in my body and skin and well-being in overall. But if I had suffered in silence on my own and not asked the questions, I would have never known that there is a solution to all this. I want women to know out there that there are people who you can talk to, who you can confide into and seek for help, like Dr. Jane. And you can even talk to the women in our community. You can share your experiences from where other women will also learn from it. There is a solution for all this, to all this. And after we have been through all this, there is a beautiful and joyful life waiting for us ahead to enjoy. Let's get Dr. Jane to answer all our questions. So Dr. Jane, I'm going to ask you a few questions where you can explain to us exactly about menopause. What are the symptoms of menopause?
Thank you so much. So symptoms of menopause, they tend to vary depending on individual hormone response when the time comes when menopause sets in. So some women may experience hot flashes, and these hot flashes, they vary in degree in terms of how often they will experience in a day, in a week, throughout for a few years. But also they experience mood changes, whereby they might have anxiety, depression, okay, and also they might experience poor memory, even have poor concentration, but also vaginal dryness or sexual dysfunction. And these are some of the symptoms that they may experience.
Right, and what about sleepless nights? Because I go through a lot of sleepless nights due to the horrible hot flushes, and once it's there, I just can't go back to sleep. And is that like part of the cycle, or what is it?
Oh, okay. So sleep disturbance has been reported by some of the women, and this is due to the experiencing of the hot flashes, and most women express it as having night sweats. And once they sweat at night, they cannot sleep anymore. So even the insomnia or the loss of sleep comes because of the hot flashes they experience, or the night sweats is expressed by most of the women in our society.
So Dr. Jane,
Yes.
why do menopause symptoms occur?
Menopause symptoms occur because of the estrogen withdrawal. During the menstruation or during the reproductive age, all women have normal levels of estrogen and progesterone, which together they help to balance and make us feel good and have very good body function. So when menopause sets in, estrogen becomes very low, to the extent it disturbs different parts of our body in different ways.
Right.
For instance, in the hypothalamus, where the thermoregulatory center, it is disturbed. As a result, the woman will start having the hot flashes. And when a woman starts seeing hot flashes, she is no longer comfortable. She cannot do her work as usual. She cannot even sleep. And this creates anxiety and depression. So with time, estrogen also, it has been discovered by the scientists, there's lots of receptors in our brain. So if it is very low, also our cognitive function, our brain function is impaired to a certain level that it is reduced. And this is why women present with memory loss, and concentration becomes very reduced to a certain extent. So the whole effect is a cascade because of the low estrogen in our body.
Right, okay. Now I get it, where it all comes from. Is there a difference between perimenopause and menopause? Is there a difference between the stages when you get into perimenopause and when you eventually go into menopause? Is there any kind of a difference in there?
Yes, there is a difference in terms of the timing. So when you say perimenopause, we refer to menopausal transition. So it's a period of about 4 years or so prior to menopause setting in. And usually these women will tend to have irregular cycles, and these cycles might be disturbing their normal body function, even the socializing as well, in terms of the partner as well. When we talk about menopause, there's total cessation of mens for 12 months. So definition of menopause is when a woman has not seen a mens for the 12 months, then we define as woman having menopause. So in perimenopause, there's irregular cycle, which a woman might experience, but also they might start also having those symptoms of menopause that we discussed earlier, such as hot flashes, sleep disturbance, and they tend to be pronounced as they go into the menopause. And this perimenopause we define for women of about 40 years of age until from the time they go into menopause.
So there is a like a age figure where the perimenopause starts.
Yes,
because
exactly.
I hear a lot of younger women saying, "Oh, I'm going through menopause," but they are only 30 years old or 35 years old.
No.
Is that possible? Is it possible to go into that kind of stage when they are at that age?
At 30 years, no. So once the woman is below or under 40 years of age, we term the woman as having premature ovarian failure. And they would tend to have almost symptoms like, but not as in perimenopause and menopause. So it's a bit different. So under 40 years of age, we say woman is going through premature ovarian failure. Above 40 years until the age of menopause, we say perimenopause. So it's different.
Right. Tell us more about the changes that happens in your body when you are in menopause or when you are going into menopause. What should a woman expect changes in her body when she's going into those phases of her life?
The changes, they might be similar to the one who's already in menopause. So first of all, as I said earlier, we'll have the regular cycles. So might skip their mens, or might even not see the mens for 3 months or 2 months and then comes back, or might even have it 2 times in a month or not at all. And some women, they even feel they're already in the menopause. Actually, they'll come to me and say, "Doctor, I've not seen my mens for 4 months. I believe I'm in my menopause." Actual fact, that is just perimenopause. Okay. And there have been reports of hot flashes. Okay, 80% to experience hot flashes, sleep disturbance. Okay, and also they tend to have weight gain because of reduced metabolism with the low uptake of energy. But at the same time, they also experience mood swings. Even in the family, we'll notice that there are certain emotions or feelings that are presented that were not there earlier, maybe in the 30s or 20s. And also the concentration might put something here and then forget where that thing was put, and then we'll start looking for it all over again. This is all because of that transition change of going to menopause. So these are the few symptoms that women experience. But having in mind, because of hormonal influence and change in the way our body has been made and environmental factors, some women will not even experience these symptoms, or they might have one of the symptoms and not at all, depending on how the body is changing from one form to another as aging process takes place. Yeah.
Okay, brilliant. Wow, I'm learning so much from you, Dr. Jane.
You're welcome.
Tell me about low esteem, because there are so many women out there in our community who feel so low and they feel they cannot talk to other women about it because either they are ashamed of talking about it. So do you really feel those symptoms of being low and you feel that that your esteem is always low? You just you just don't feel that you're up to it, like in the sense like when you go out and then you just don't feel like you are yourself, like how you would be in your earlier age.
Okay. I hope I won't feel that way. Yeah. So when there's estrogen, it seems to be having a great important role in women, and actually empowers us, makes us feel good one way or another. Now, having the low estrogen levels, our body tends to deviate from the way how it used to function. There's a loss of deficiency in different aspects, from the brain to the bones, even to the way how muscles feel and the way we coordinate. But it's really difficult for a woman to recognize that. and to be reflected by someone that this is something normal, it happens, and how to improve. So there are some women, of course, they will tend to speak to their friends, the spouse, if they're free to communicate about what they're going through, and seek medical advice from a doctor. And then through the counseling session, we tend to bring them up, and they have that confidence, and they stand up, and they feel whatever they're doing that is perfected and is back to how they were in their 20s and 30s, and life moves on greatly. So there are women that do experience that, but this is because of the estrogen withdrawal, the hormonal changes that are taking place. But what is very important is to understand that I'm going through this, or this is happening, and it's transient periods. It's not be like forever, and we can be better, we can do better. And there are different ways, counseling sessions and talk therapies, group therapies, that tend to empower and help women feel they're okay. It's not something that they're doing is wrong. And I remember there was this couple one day, they came to me and they were concerned, like the wife is kind of like losing it. But it's not about losing it, it's about the changes to understand. So how can you support her? So if you know that if she puts a bag in one area, the next minute she doesn't remember where it is, it's a matter of just helping her to tell her where it is and where to put her things so she can easily remember her stuff even at work. And that's how it perfects and works very well. Yeah. Love and support.
Love and support, yes. So important within a family, for a family to understand what you're going through. Right?
Yeah.
How do doctors check for menopause?
So doctors check for menopause by looking at the hormones, and this helps us to know at what particular extent or level the hormones are, if they're very low or low, because also they tend to reflect the symptoms that the woman will have in menopause. So we usually check for inhibin B, anti-Mullerian hormone, follicle-stimulating hormone, luteinizing hormone, and estrogens. So for the woman in menopause, we expect estrogen to be low, follicle-stimulating hormone to be high. But in some women, may not necessarily determine the follicle-stimulating hormone to be high. So it depends with the individual response and the body changes that take place. But all these hormones also, in addition, do help us to know at what level the woman is it in early menopause or late menopause, and also counsel on the symptoms that might occur and how to how to deal with how to treat the symptoms, and when to seek the medical advice in case they become very severe to the woman.
Okay, and what are the treatments for menopause?
So treatment is divided into the three aspects. First of all is the hormonal therapy. Some call it menopausal hormonotherapy, or in the back we used to call it hormonal replacement therapy. But these hormones, basically we have estrogens and progesterone in some of the women, depending on the situation. For instance, if you have a woman who had the hysterectomy, there's no uterus. So the aspect of progesterone doesn't set in. So the estrogen will just work very well for this woman. But there are things we consider, and in terms of assessing the individual, we individualize every woman. I'm saying this because there are women who have certain medical conditions. Some of women have breast cancer. This is really contraindicated to give them estrogen. Women who have hypertension, they are contraindicated to have these medications. So actually, when it comes to, in terms of initiating hormonotherapies, we consider each woman individual in terms of what they're going through. So for those that don't have any contraindications, as I've mentioned earlier, some of them, they can use the hormonotherapies, and that variety of them. There's the jelly form estrogen in terms of jelly forms, can be tablets, can be creams, can be different forms that can be applied. And all of them, they tend to vary in terms of the dosage that they have. And the doses that have been set in, for instance, for the tablet of 1 milligram per day, it's very low. 0.05 milligram in terms of the gels, and others is very low, depending on the individual woman. And the low levels there are, as the woman takes them daily, they're very helpful, and they don't get any side effects, and it helps them relieve the symptoms that they get in the menopause. The other alternative is we have this some women experience depression and anxiety because of the hot flashes and night sweats that they complain about.
Yeah.
So we can provide them with these antidepressants that can help them sort out the particular symptoms that they have, and feel better as well. Also, we encourage the families to be supportive, to understand what they're going through, so that they can be able to cope together and live together in a very happy manner, because life is a continuous process and it only ends when we die. But when you have a family that understands and touches every cornerstone of our life during the menopause, it's really supportive. And this is what we call cognitive behavioral therapy that we provide to these women.
So one of the symptoms is vaginal dryness and discomfort. Can you tell us more about that?
Wow, that's a very sensitive question, and it really
Sure is.
yeah, it really touches lots of relationship and ends up in a bizarre. So vaginal dryness, it occurs due to the low estrogen, because the estrogen has the function of making the vagina thick, mucus discharge is well released, so the area is well lubricated. Even the elasticity of the vagina is all depends on the estrogen. So now if this woman has low estrogen, what happens is the vagina becomes thin or atrophies, and there's less secretion, and even the elasticity to distend and relax is not there. And this creates so much pain and discomfort in the woman. But there's something I want to tell the woman: once you have this symptom, it's good to share with your hubby so that you can seek medical advice, because there are options that can help to relieve those particular symptoms. For instance, we have the estrogen creams or tabs that can be used to ensure that the woman has pleasure during the sex, as well as we have lubricants for those who cannot go for the hormones that will help to ensure that the vaginal secretions is good and there's comfortability, and the couples resume back to their normal sexual life and live together happily ever after.
Dr. Jain, my last question with you. And I promise that's my last question, because I'm sure a lot of women and a lot of people out there want to know the fact of this question.
Oh, it's okay.
So you have to be very honest. Do men go through menopause?
What an interesting question. Yes, they do when their wives in their menopause. They cannot experience the same things that you're going through, because it's so stressful at a certain moment. And this is the point whereby I really want to emphasize on the spouses to support their wives as much as possible, because it's really can reach to the extreme level. It's very stressful. The quality of life can be so down, and everything that is surrounding the home will become homeless. So really urge the partners, the spouses, to really encourage the wives and to make sure they're always with them. If something not very clear, try to understand what can be done better to improve, because it's just a transition period. It's not like forever going to be that way. There's a period of years that when they lapse, things will become better. So emotional love and care and support, these are the golden things that need to be maintained in our families to ensure women are safe and feel okay and life goes on as usual.
Thank you very much. It was lovely having you over our chat and with a lovely cup of tea.
Yeah, sure.
Thank you.
Thank you.
Wow, that was such an informative session. As a woman, I'm also going to go through menopause, so I got to learn so many things today. I would like to thank personally Mrs. Femina to come forward and sharing your journey. You were the voice for all other women out there.
Thank you very much.
Thank you for taking this platform and sharing your journey.
Thank you very much.
Thank you. Thank you, Dr. Jean, for sharing your time and knowledge with us today. It was very informative. Thank you both of you once again.
Thank you.
Thank you everyone for joining us for this program of Chat Over Chai. I hope each and every one of you learned something out of it. Well, as a woman, I learned a lot. We would like to tell you to seek medical advice before using any of these things that has been discussed in today's show. I hope everyone learned something again. Thank you and Ya Ali Madad.